Great. Well, welcome everybody. My name is Deborah Spiegel. I'm a board certified music therapist and I host online continuing education classes. And I'm glad to bring this to you today, the introduction to social skills training with children through music therapy with Jeffrey Friedberg, who's also a board certified music therapist and a licensed creative arts therapist in the state of New York.
So while this is valuable, you want to promote generalization. You want to promote learning a skill. It's the old adage, you can give somebody a fish and they eat for a day. You can teach them how to fish and they eat for a lifetime. So we want to not just teach them how to make a friend in that particular situation. We want to teach them the actual skill that they can use elsewhere. So social skills picture stories are mini books that use illustrations to depict children demonstrating various skills in a step-by-step way. They contain situations, feelings, conflicts, and target skills broken down into their parts. What happens when the skill is used appropriately, and they also show the positive consequences. This type of approach relies less on an instructor modeling and less on verbal instruction. Here's an example. Can you see the screen? So this might be a social skills picture story that I found this on the internet. This is a very short story. When someone is hurting or annoying me, I will look at them, put my hand up in a stop sign, say to the person, stop it, I don't like it, and if that doesn't work, I will get help from a teacher. So this sort of breaks down what happens, the situation that a child might find themselves in, and using pictures and simple words depicts the situation, what you can do, how it would feel, and what to do in that particular situation. And also using images is the cognitive picture rehearsal approach, which are cartoon-like pictures on index cards made for specific situations that a particular child would find themselves in. And they really contain, and I'll show you a picture of one as well. They show three components: the antecedent to a problem, what's happening before. They show the targeted desired behavior, what the appropriate social response would be, and then the positive reinforcer, which is really the payoff of why we're teaching social skills, which is what happens when we use effective social skills, is that everybody gets some of their needs met as well. So here's an example right here, which is a cartoon-like drawing, which is made for a particular child, and this is from one of Dr. Baker's books as well. He has a book on social skills picture book, and it uses pictures, it uses narration, and it also has a script of what the characters are, with the thought bubble is what they're thinking and feeling, or might be thinking and feeling, and then what they're saying. So the antecedent to the problem is that Matt is playing at his computer. The situation and the conflict is that the teacher tells Matt to get off the computer. And then you can see in the thought bubble that Matt feels mad. Then he thinks, which is the target. The skill is that he thinks to himself, if I wait, if I accept no, I might get my needs met later. So Matt says, if I get off, the teacher will be happy and let me use the computer again. She will also give me a point towards my reward. So then it shows Matt responding in card 4, okay, I will stop. Then you see what the teacher's feeling. And if you follow the story to its completion, the teacher rewards Matt, and he gets to use the computer later. So this is called cognitive picture rehearsal. And this is something that you can use before a problematic situation. You can prime the child. Maybe before it's computer time in the classroom, a teacher can go through this cognitive picture rehearsal with a child. Or maybe a parent at home can review these at night, at bedtime, as a way to really help the kids sort of memorize some of these skills and is for some kids the visual element is very helpful, the very simple graphic element. We just have a couple more to review. Social stories are something developed by Carol Gray, and they're stories that are written in the first person for a particular child based on specific skills that they're working on. And they focus mostly on what's happening in a situation and help a child gain some perspective. They contain descriptions of the situation. They have directions and affirmations of what to do, and it's something that you would read with the child, and they would read on their own. They would really overlearn these stories. Maybe it's a child's having conflicts in the lunchroom, so maybe they're misinterpreting children laughing, and they're taking it as being teased. So the story might discuss what the kids are actually laughing at and how to understand if it's about them or if it has nothing to do with them. So they're actually just stories that teach, that are created just for those particular children. And we just have a couple more. The structured learning approach is really what Dr. Baker writes mostly about in his social skills training manual. And it's a combination of what we talked about before, the behavioral and the developmental approaches. It has didactic instruction, which is the behavioral, which is an explanation of a skill and its steps. It has a modeling of the steps where the teacher and student would model how to use that skill. It has role-playing of the skills with feedback from the other kids. And then it has time to practice within the group. So I'll go over those again. The four components for the structured learning approach are the didactic, which is the teacher explaining the steps. Sometimes they'll write out the steps on a smart board or a piece of poster paper. The key is really to engage the kids, and he writes about using a game show approach. So you want to be a millionaire. There are many music therapy ways of engaging kids and teaching these skills as well. The modeling of the skill steps is modeling the behavior, showing them what the skill looks like. And then role playing, which is asking the students to act out the skill in the right order. And then the kids in the group review and give corrective feedback. So maybe the first thing they do is to talk about what they thought went well. And this is, for some of Courtney, for some of your clients that are very young and probably don't have the verbal skills yet for this. There's other ways, maybe thumbs up or thumbs down. As they get more verbal skills, they can be more descriptive, maybe in your older kids group, the 5 to 10-year-old group. But there's ways to adapt this to younger kids. They can talk a little bit about what, the feedback can be, how can they make the role play even better. And then the fourth component is practicing the skills, and this is, again, to generalize what they've learned in the class. So they have a more open playtime in the group where they can practice the skills. They're also asked to think about where and when they can use these skills during the week outside of the group. And when they come back the next week, they're asked about situations where they've used the skill during the week. So the goal is really to get these behaviors and skills used during the week and practiced outside the session. So I just have one more approach. Do you have any questions so far?
No, I'm just trying to think of, a lot of the stuff that I did, I am doing. It's just, something like this role-playing exercise. I'm just trying to think of, with the varying levels of functioning in my older group, how I would do that. But I'm sure you'll get to that.
Yeah.
How I can, adapt it to every level.
Yeah, there's just a lot of information here, and then there's really, I think, an infinite number of ways, whether it's using puppets or using instruments or using songs. We'll talk. We're going to get to that. That's mostly the third hour. where we'll talk specifically music therapy approaches, but we will get to that. So the last approach, which is very popular these days, is video modeling. It's kind of the YouTube model, where videos of children in different social situations demonstrate how to use these skills. Children really are engaged by watching videos. They see what to do and what not to do. Modeling approach is often accompanied by children talking about what they've seen in the different situations, giving feedback, and also then trying out what they see. It's very important not to, with certain kids, not to model the wrong way to do a behavior, because some kids really enjoy copying that. Mm-hmm. A particular child who might be prone to get negative attention, they when you demonstrate the wrong way and the right way, they may just do the wrong way, and the laughs are enough of a reinforcement to override whatever you can offer. So the thinking is to really focus on the right way to do it, and to know your kids that whether demonstrating wrong and right is the right approach, or just to demonstrate the right way. So that's an overview of a lot of the social skills training approaches that you'll see in schools and in therapy offices right now, not including music therapy. We'll get to that. But I wanted to talk a little bit about settings and populations. I currently work in mostly in private practice, and I also consult with schools and different organizations. I work with children and adults in individual and group situations. I teach typical children in a music education settings. I have children with special needs coming to me, kids on the autism spectrum. I have kids with ADHD. I also work with adults with psychiatric disorders and senior citizens. Some of the sessions are strictly social skills training groups, but some are music education, or they're music, or just more general music therapy groups, where but pretty much across the board I incorporate some aspects of social skills training. So even if you're running a group that's not a specific social skills group, I imagine there's something in what we're going to talk about that you can adapt for social skills within that situation. I think it's very adaptable information. My office is called Music for Life Creative Arts Therapy. Right now I have 3 different social skills groups that I run, and the first is for preschool age children, 3 to 5, and it's called Getting Ready for Kindergarten, and it really focuses on skills that kids will need when they enter school. And in all of these groups, the goals are based on the individual needs of the children in that group. But just to talk generally what types of skills many children need as they go into these different situations, the Getting Ready for Kindergarten, the school readiness skills, many kids have challenges with managing their feelings of the transition to a new teacher, a new student. That includes the greetings, making friends, joining others, asking to play, listening, and leading. Those are many of the skills we cover in that group. The elementary school group focuses really on making friends and class participation, as well as the skills that we mentioned above, accepting no, learning about making mistakes, and that it's okay to make mistakes. That's how we learn, asking others to play. And I have a new group, which is a high school young adult group, which is a rock band group, where we work through learning how to make friends through, actually it's an actual band that the kids have, and we work through that format. So these are the 3 types of groups that I'm running right now and really have informed a lot of my work, which is the preschool, Getting Ready for Kindergarten, the elementary school, which is really focused on learning how to be socially successful in elementary school, and then the high school group, which is really a rock band where they learn how to work together and cooperate and make friends, but within it's a little more complex musically. we'll go through the skills soon. I wanted just to talk briefly about the different types of settings that you might find yourself in, and the pros and cons of those settings running a social skills group. If you're in a school or a hospital, you tend to have to work with the kids that are provided to you. There's less choice by the therapist. The goals tend to be set by a treatment team, and the size of the group, the times of the session, and the number of kids tend to be chosen for you. Whereas in private practice, you have more of a choice who is in your group. You can decide whether you want to have kids with similar goals or different goals. You can choose how long the groups are. I know you were asking about that. The length of treatment, how many sessions. There's really pros and cons for both of these situations. And we can talk a little bit about it maybe in terms of the business of running a music therapy social skills program. But I really think they both have benefits, and they both also have challenges. Yeah, I think in an institution they're providing you with the clients, and they show up, and you don't have to worry about who's there and who's not there. Sometimes it's helpful to have the input of a team. But when you're in private practice, there's a lot more flexibility, a lot more choices as a clinician that you have to make. And when we talk about some of what's the intake and treatment planning, that will inform how you set up your group. So before we go on, I wanted to talk a little bit just about why using music in social skills, and what particularly about music makes it effective as a social skills training tool. Do you have any questions or comments so far?
No.
It's a lot of background. Music really, it provides so many opportunities for both group and individual expression. It's inherently social. It can be both structured and unstructured. It's something that's really across most cultures. Music is used as a way of people forming relationships. It's something we do together, but we also do it for each other. There's many aspects of play in music. It really mimics language in so many ways, and emotional expression. Whether you're playing loud or soft, slow or fast, the contour of your melodies, the articulation that you're playing, it really is such an expressive medium. The repetition and the rhyming of the songs make them easier to memorize. And then the patterns and sequences within the songs really mimic so much of our everyday lives that really make them very easy to remember and really internalize. And one thing I think that makes music wonderful is that it offers opportunities for many different types of learners. So there are those that are more kinetic and movement learners, where the movement and dancing is something where that's how they learn. There are those that are more didactic learners, that really, the words in the song, the message is how they learn. There's visual learners who really learn by watching, whether it's music videos or reading the words of the song. And there are the experiential learners who really like to practice the skills in real time. So there's just so many different approaches for so many different kids. And music in traditional kids music really is based on learning skills, whether it's if you're happy, clap your hands or ring around the rosy or duck, duck, goose. Those are really social skills training songs. They're teaching kids about feelings. They're teaching kids how to work together. It's really baked in the cake. Kids are really primed to use music as a way to learn and grow. And whether you're in adolescence, music is really, it's a primary way that adolescents form their identities around the types of music that they like, whether it's the fashion or the message or the attitude or the rhythm and the beat. So many kids either from that or gather around particular types of music. It's really, like I say, it's baked in the cake. It's really, it's a large part of why music is so powerful in social skills training.